Breastfeeding has many well-established benefits for mom and baby, and the American Academy of Pediatrics recommends that moms breastfeed babies for 6 months. However, only about half of moms breastfeed for 6 months. And we also know that moms who are African American, have lower income, or less education are less likely to breastfeed.
Doctors like us, who take care of moms and babies, understand that breastfeeding can be really challenging. Efforts to support breastfeeding include baby-friendly hospitals, workplace policies to support breastfeeding, and breastfeeding classes. Classes like this can give parents information about how to breastfeed, the challenges that may come up, and how to balance breastfeeding with other responsibilities like taking care of other kids and going back to work.
So we know that breastfeeding is important, and we know that breastfeeding classes are available. But we don't have information about how many parents across the country are using this resource. At C.S. Mott National Poll on Children's Health, we wanted to find out what percentage of expecting parents attended breastfeeding classes.
What we found was that overall, 26% of parents attend a breastfeeding class. This number goes up to 40% among first-time parents.
Because we know that certain factors are linked to breastfeeding rates, we wanted to see if the same factors are related to breastfeeding class attendance. Surprisingly, we found that attendance to class was actually not related to a parent's race, income, or education.
Instead, we found that being uninsured really matters when it comes to breastfeeding classes. Parents without insurance were significantly less likely to attend a breastfeeding class than parents with either private insurance or Medicaid. Only about 1 in 10 parents without insurance participated in a breastfeeding class.
We are encouraged that parents of all racial ethnic backgrounds, education levels, and income levels are all attending breastfeeding classes. Since there are later differences in who actually breastfeeds, future studies are needed to look into whether breastfeeding classes are meeting the unique needs of all families. However, parents without insurance are not attending classes, which brings up the question of cost. Breastfeeding classes cost between $30 to $80. This may be affordable for some families, but may not be affordable for families who have financial concerns about medical care.
We want to encourage breastfeeding for all families, so we need to make sure that breastfeeding support is affordable for all parents, not just those who are insured. Increasing access to breastfeeding support may require a team approach with government officials and healthcare providers and community members all working together. Imagine if your doctor gave you a prescription for a breastfeeding class as a routine part of prenatal care. Or if new parents could attend a breastfeeding class in the hospital before taking their newborn baby home.
Classes could also be provided in neighborhood settings through WIC or faith-based groups. Working together, we can provide breastfeeding classes that are relevant and affordable for all families.